All right, so before we get to the questions, just to summarize all that, we are ecstatic to be providing medication to patients of Staunton. We've been waiting for this opportunity. I can't express enough how excited we are to open our doors and to help people out here in the community and the surrounding communities. Like we had talked about earlier, this isn't our first rodeo. You know, we've done this in other places, but we also respect the fact that it's a combination of working with the legislators, working with the Board of Pharmacy, working with the other registered organizations, because each state is a little bit different, and that's the most important thing, and the byproduct of that is going to be better results, better relief for patients. We talked a little bit about the safety and security. You know, there are measures in place, there is tracking in place to make sure that medication, you know, is handled appropriately. And really, I mean, that's what we teach people is that, you know, because questions come up sometimes, you know, what if it gets in the hands of my child or this, well, how do you treat your prednisone? How do you treat your penicillin? Right? What measures do you take to make sure that the dog doesn't swallow that or the kids don't have that available? That's the same sort of way that we want to teach people and educate people medical cannabis should be handled. And then we also talked about a little bit about why we have these stigmas that we have nowadays, the products that we have available, and the ratios of THC to CBD. So that's why I had to present. Thank you so much, everybody. Now let's open it up for questions. Now before we do the questions, I also want to introduce Katie and then Chris. So Chris works you know, in conjunction with our team at PharmaCann. Katie is with the Virginia Medical Cannabis Coalition, who is the industry association that works and supports the 5 registered organizations here in Virginia. So I just wanted to introduce, because as the questions come up, like I said, I'm a Midwesterner. I got my Chicago accent. You know, they might have a little bit more information about the nuts and bolts of, like, you know, the actual program out here. So questions, anyone?
I have a comment and a question. The comment is, could you work on making a hybrid that removes the increase in appetite? Or some of us don't.
Yeah. So it's right. So it's interesting that you say that because of the terpenes and because how I think they modulate the interaction with which receptors in the brain cannabis actually triggers. Certain strains will do the exact opposite of giving you the munchies, right? So it's the hypothalamus, I think, that regulates appetite. So if THC gets to that receptor in the hypothalamus because the terpenes are sort of leading the way, then it might have the side effect of hunger. Now, to take that a step back, for a stage 4 cancer patient that's not eating anything, that's a great thing for them to have. But at the same time, there's people that are treating other conditions that might need to be, that are working to weight management or weight loss. So that's where, you know, because of where that starts and because of those terpenes, you might have a different response one strain versus another. Okay.
Then my question is, with the relationship between our doctors and your company, will we have doctors that will actually prescribe a certain 2-to-1 or 3-to-1, or do they leave that totally up to the dispensary?
Yeah.
I wasn't sure how that works.
Yeah, so definitely, I mean, the physician is, and physician, when I say physician, it's either physician, nurse practitioner, or physician's assistant, is an extremely important part of this process because they already have that bona fide relationship with the patient. They know their patient better than we can ever know in the hour that we have with that initial consultation process. Now, I know that in different states, like for example, New York, when they first started the program, they had it where the physician actually you know, put together a recommendation that told the pharmacist, okay, I only want this patient to be using a 1-to-1 ratio, and I only want them to be ingesting it. You know, so I have seen different states that put that stipulation in place. But really, I mean, I think the most important thing is our pharmacists developing a very strong relationship with the providers that are in the community and that are recommending patients. Because they're going to be the ones that, you know, if they see something that, you know, might not be going right with the regimen, we want that open line of communication with the provider. So really, you know, to answer your question, if it's not in the regulations where a provider has to actually put 2-to-1 ratio, 3-to-1 ratio, if we can get that provider to the point where they're educated to actually tell a patient, I want you on a 2-to-1 ratio, and have them communicate that to our pharmacist and our patient care rep, wow, that's some pretty powerful care, right? So I mean, that's, so point being, you know, a lot of the times it's the pharmacist and the patient care rep working in conjunction with the provider. I don't think the regulations have it hardly written that, okay, I have to recommend just this 2-to-1 or the 1-to-1.
Mike, can you repeat the question when they ask you? We can't hear all the questions back here.
Absolutely.
Thank you.
In Virginia, not every physician can prescribe medical marijuana, is that correct?
Yeah, so the question was, in Virginia, not every physician can prescribe medical cannabis. So my first thought is that, you know, that's one of the things that we try to educate the physicians on, is that they're not actually prescribing, right? They're recommending, right? Which is a lot different as far as the regulatory agencies that it goes through, and, you know, the DEA and things like that. I mean, it's a little bit different. They're not actually prescribing, but they are just recommending that this person is applicable to benefit from cannabis.
In Virginia, every doctor who wants to recommend marijuana will have to be registered. So it's not that every doctor can, but there is a process that they have to go through.
And thank you for
I
being.
don't think that's just in Virginia, I think that's everywhere.
Yeah, well, so it depends. So there are certain states where you just have to be part of the 1987 Physician Practices Act, you know, an MD or a DO. You are correct, yes, in Virginia you do have to register to become a certifying provider in the program. And I think I was looking, I was doing some research online. I think actually on the website you're able to access the list of providers that are registered out here. Yeah.
There's one in Staunton so far.
Perfect. Cool.
I heard that the physicians, that there was a problem because of the federal issue, that's still a problem, that if a physician gets registered, that might create problems for them with Medicare and other federally funded programs or hospitals. Is that true?
I haven't heard anything about that as far as.
That sounded like it. Well, and also just how soon do we have any hope of the federal government declassifying marijuana soon?
So, in my opinion, I don't think it's a question of if, but it's when. And that's going to be a totally different climate. I mean, so the one thing that's going to happen when federally, you know, the regulations do change is that cannabis will be able to be exported across state lines. Like, the cool thing about the way that the programs are set up right now, I mean, everything is local. You know exactly where it's coming from. It's all made here in the state. So I think, you know, as far as time frame, you know, who knows when that's going to happen, but that's going to totally change the landscape of what medical cannabis looks like.
Are the plants grown in soil or is it hydroponic?
Yeah, so we grow, you know, I can't speak for the other organizations, but we do grow them in soil. Greenhouse has been the method that we've used in a lot of the other states that we put up cultivation and processing centers.
Your pharmacists, do they have to have additional training above a pharmacy degree? And if so, where do they go for that training?
Yeah, so no, there's nothing additional regulatory that's required. We do have internal training processes that all of our employees go through, you know, just as far as, you know, customer service, how to work with patients. There are certain states that are talking about implementing third-body agencies where each and every employee has to go through an accredited program that, you know, the Department of Health or the Board of Pharmacy says, okay, yes, this organization is something that's credible and that we, you know, we agree with their content. And then they would have to go through 8 hours of continuing education every year, but not at this point. Yes?
Yes, you have made mention of the fact that you all have facilities that be opening up this Staunton.
Yes.
What about similar facilities elsewhere?
Yeah, so from my understanding, there's 5 different registered organizations right now, and as far as the locations, they're going to be spread out strategically and geographically across the state to try to service, you know, the whole population. So that's the way that we've set them up right now.
I can tell you, there's 5. There's one in Manassas, there'll be one in Bristol, there'll be one in Portsmouth, and Richmond.
Perfect.
What about Charlottesville?
No.
Doesn't have it?
Not in Charlottesville. This will be the closest one, or Richmond.
That question kind of stems to my question too, is how are folks that live like an hour plus away supposed to be able to have available access? Is there going to be delivery services? Is it going to be based upon that patient having a driver to take a 2-hour round trip to get medicine that they desperately need?
Yeah, so I know that, I think it was just recently
What's the
they,
question?
oh, sorry about that. Thanks for the reminder. So the question was, for patients that live, farther distances from these locations, what things are going to be in place to help minimize the hassle that would take for them to get medication. So I know recently they just adopted, I think it's a caregiver program, right, where you can appoint a caregiver that can go to the dispensary, they can pick up the medication for you, and then they can bring that back for you. So that's an option that we have for patients that have problems with the travel.
And we will be doing delivery here at the Staunton facility, and obviously we'll, working out the details of that delivery once we get up and running, but that will be part of our program as well here in Staunton.
And I think that's really important.
Here.
I'm gonna ask the drug test question.
Yes.
Is it something that is going to show a positive on the drug test?
Absolutely. I mean, if the employer is testing for THC, definitely our products, they have THC in them. And that's an interesting thing that you bring up because, one of the things that, just talking with some of the people out here today, are these over-the-counter CBD products, right? So, and as far as the regulations, the over-the-counter CBD products have to have less than 0.3% THC. But because that's such an unregulated business right now, you hear horror stories about people that think that, okay, this is safe, this is just CBD, but then next thing you know, they require a drop at their employer and they don't pass the drug test. So that's scary to me, but at the same time, it is going to show up on a test because it is THC, and if they do test for it, so a lot of the times, I tell, talking with your employer and working with your employer is the most important thing.
That does bring up a question in regards to that. That person that needs it,
Mhm.
and they're registered, and when you talk to the employer, they are legally taking something for their benefit.
Mhm. Absolutely.
But it has this, one of the courts, I think it was in Minnesota, did rule that the employer can disqualify you from the job, even if you're registered, even if you're taking it for your benefit. So I'm just saying that, so you don't, you know where you stand with your employer.
There's also a contradiction in that I can have a prescription for Adderall and test positive for amphetamines.
I'm not
Anyone here is on pain management, so I think that is where the employer has to give at least some, because, if we can come to school or work, under the effect of Adderall, which is an amphetamine, it's illegal,
A little flexibility.
Yeah, there has to be some flexibility.
Virginia is a right to work state, though, so that it hinders any type of patient protection
Mhm.
for that reason specifically.
And if they don't want to deal with it, then it's just easier for them to hire someone else.
Yeah.
No, if the alcohol is legal, if I go to work drunk, I don't have a job.
Yeah.
Just saying.
Yeah.
Right, boss?
So that's, one thing that I just want to point out, these are obviously very, very important questions and very, they affect your lives, very predominantly, these drug tests and things like that. As the program matures, what I try to remind myself, we've had, alcohol has passed prohibition for how many years? 80, 90, 100 years. So with these medical cannabis programs, we see this all the time. It's like the garden hose analogy. So what I mean by that is when you plug in your, when you screw in the garden hose and you first start it up, right, doesn't it spunker a little bit, like sort of spickers a little bit? That's what we see with the medical cannabis programs when they start in the state. There's that little sputtering, but eventually you have that nice fluent stream of water, right? So, these are questions, they are concerns right now, and as the sputtering of the garden hose stops and the stream starts flowing, I think that's where we're going to see some more concrete answers when it comes to some of these tough questions.
But how does this affect when you're driving a vehicle?
Yeah, so
If you
definitely.
take this, like if I travel from Virginia to another state that doesn't allow this,
Mhm.
and I get stopped along the road, go through these tests, what's the laws about that?
Yeah, so definitely medication has to stay within state lines. Right, so, and I know it's a little bit weird out here like on the East Coast because, you could go from one state to another state pretty quickly. Like it's a funny story because like in New York, when we deliver, like we have our cultivation center that's in Orange County and we deliver to the Bronx. And what happens is the quick path to get to the Bronx is to go through New Jersey. right? That cuts off about an hour of time, but because of the regulations that this product cannot cross state lines, they have to sit in that Manhattan rush hour traffic to get it to where it needs to be, just because that's a very, very important thing that it has to stay within state
What
lines.
kind of operating the vehicle?
Yeah, so definitely, I mean, as far as motor vehicles, you don't want to do anything while impaired, right? And I always tell people, you sort of treat it the same way that you would anything, like a medication, The kicker about THC is that it's not really as cut and dry as, okay, I could take a test right now and I could, see what, how much I ingested, 10 minutes ago or 20 minutes ago. Because it's fat soluble, because it stays in your system. So like I can ingest cannabis today, and 29 or 30 days from now, I could do a test and it could show up in my system. Yeah, I'm not impaired, but still, just because of the fat solubility of the cannabinoids, that is something that, is throwing a little bit of a monkey wrench in that.
One more question. Have the VA doctors been in with any of this, VA medical doctors?
Yeah, so I know that, from my experience in other states, VA doctors, they can't certify patients for the program, but at the same time, there's states that put regulations where there's amenities for veterans. So like, for example, in Illinois, it's a $150 application fee, but if you're a veteran, it's a $50 application fee. So that's a little contradictory, right? Okay, veteran, VA doctors, they can't have anything to do with this, but yet let's put together a statewide program that's going to give benefits to veterans. So that's what I've understood. Yes?
Yes, I have my certificate already, and I was wondering if you could give us a clearer understanding of when you'll actually be open for business.
Yeah, so we're planning to be open by the end of the year and operational in Staunton. Now I know that.
I know that's a condition of your license. I was wondering if you had anything more specific.
No, I mean, we're working very hard to open up as quickly as we can to bring medication and relief to patients of all of Virginia. But like I said earlier, it's a three-prong approach. There's three different things to this stool. So it's the Board of Pharmacy, it's the legislators, and it's the registered organizations. Even though we're saying, man, we want to do this yesterday, we have to respect the fact that it's not just us that are making these decisions. So we want to be open as quickly as possible. Right now we're projecting by the end of the year.
Mike, maybe you could speak to, even once we're operational, then we have to start growing, and then because we can't put a seed in the ground until we get that license, so.
Absolutely. So thank you for bringing that up. So when we are able to become operational, then we do have to actually plant the medication. It is a natural plant, so it has to grow. It has to turn into, Yeah, so I mean, from seed, it usually takes anywhere from 10 to 12 weeks sometimes. But I mean, there's other ways that, that we can, speed things along. But at the same time, as far as being able to provide medication because of what was just mentioned, I mean, it's going to take us a little bit to get that available as well.
What about third party?
So I'm not sure with the other registered organizations what the status is with them, but I know that we're working very...
Another grower providing cannabis to you rather than you growing yourself.
Yeah. I know that, we're all working very hard to try to get to the point where we can provide medication for, obviously our own dispensaries, but then also for everybody in the state.
State to state, you're Hamburg, New York, Rose, can't come down here.
Can't come down here.
Across state line.
Hey, I've got a question.
Yes.
I'm a current student at Virginia Tech studying agriculture, and I just wanted to know if PharmaCann was going to offer sort of like internship programs for any student who's aspiring to get into the cannabis industry.
Absolutely. I don't want to get ahead of my skis here, but absolutely. I mean, that's something that we do in other states. I know that, we're on advisory boards, medical cannabis advisory boards at different colleges, helping them put together curriculum. So I would think that definitely is going to be a part of something that we offer here to the community, is working in conjunction with the universities.
Because Virginia Tech has a hemp research program directly, and that's actually one of the main reasons I chose Virginia Tech. And then you guys coming into Stanton,
It's like it's meant to be, right?
What's the difference in the product that you'll be selling and what I can buy with my fried chicken at the Beverly Street convenience store?
Yeah, that's a great question. So if I can repeat that, what's the difference between our product versus what we could buy at the Beverly Chicken Shack? What was that?
Well, you have to understand the quality of chicken you get. Chicken
You'll have to give me that address because I'm here till tomorrow morning. We'll see. See if I can speak on that. Right? So the one thing, about the products is that you know where they're coming from. You know that they've been tested for pesticides, fungicides, microtoxins. The Board of Pharmacy has put together some pretty stringent regulations as far as what products we can provide you and the fact of the quality of them. So, the way that I look at it, if my mom or my grandma was at the end of their rope and was losing hope and really thought cannabis could be beneficial for them, I wouldn't send her to the Chicken Shack. I'd want her to go to some place that and they could provide a certificate of analysis saying that this product is free of these heavy metals, these pesticides, these fungicides, this is the exact amount of THC and CBD. So I think just the comfort in knowing exactly what you're getting is the biggest difference between those two.
What is the qualifications that you would have to get a job with PharmaCann?
Yeah.
In the growing facility?
Yeah.
You get this, okay, to plant the seed.
Yeah, so definitely, anybody with an agricultural background, a background in, harvesting and planting, but more importantly, people that are passionate and care about the patient, I think, is one of the biggest qualifications. I've been very fortunate. I do training for the company. I train our patient care reps, and I work with our pharmacists. And that's one thing that you can't teach somebody is passion, or to be compassionate for patients that are suffering, or to have the desire to see the bigger picture that this little watering that I'm doing today, this little taking out the garbage here, is one step in the process of getting somebody relief and to stop suffering. So really, I think that's the biggest thing is, the education is important. Internally, we do train employees to our policies and procedures, but that passion and compassion is something that you can't educate somebody on.
I got one more too. In reference to all that you're saying is how well you all have dealt with cannabis in New York. You've kind of perfected it to a art, more or less. Why can't you help Tech get a little bit higher in their progress as to how they develop it here in Virginia?
So what was the question? What was that?
The question is, since you are more expertise in cannabis, how it grows, your development, processing, and all that, kind of help teach Virginia how to get on point.
Yeah.
And pass some regulations and stuff that would benefit growers.
Mm-hmm. Yeah, I think Virginia. Yeah, no, and I appreciate the.
As far as marijuana, it's illegal.
No, I ain't talking about marijuana. I'm talking about 0.3, 0.6.
Oh, you're talking about hemp? Okay.
Oh, you're talking about hemp. I thought you were talking. Yeah, hemp. Yeah, that's not. We offer
They
the.
don't grow hemp, they grow the real stuff.
I know you grow the real stuff, but it's the processing.
Yeah, no, and that's something that we definitely wash, rinse, and repeat, so to say. So like in Hamptonburg, we have Christy Orio, who's our Director of Research and Development that had 25, 30 years at Pfizer, that's developed and patented a self-emulsifying drug delivery system in the capsules that we provide. And we have full intentions on bringing those types of products to New York. A lot of the times, people from other states, senior leadership, are very heavily involved in the startup process to make sure that we train people appropriately. And a lot of the times, sometimes, we'll have somebody that, is hands-on and might live in Virginia for the first month or two while we're getting operational, just to make sure that those best practices are shared state by state.
How many jobs will the operation bring? And two, have you already anticipated growth because only 5 health districts? I don't see where, they would all be able to keep up with, the demand once it is, fully up and operational, because it covers a pretty wide area. It does cover Charlottesville and those other areas. So how many jobs, and have you anticipated growth?
Yeah, absolutely. So as far as jobs, thinking about, our other facilities, at the cultivation processing side, we employ anywhere from 40 to 60 people, depending on the size of the facility. On the dispensing side, anywhere from 8 to 12 people. And definitely, local is where we like to work with, local municipalities to make sure that we're finding the appropriate people locally for the jobs. And then as far as the program and the growth, you know, what I think about that is that, you know, we're still in the beginning stages of what we're doing here. To talk about, you know, expanding or bringing new people on is like putting icing on a cake before you bake it. Right? So I think that, you know, everybody has worked very hard, and we want to make sure that for the state of Virginia, we do this right. And yes, definitely that's something that is important, is being able to service as many patients as possible, but we want to do it appropriately and at the right time.
Do you, I'm sure it's going to vary greatly, but can you give us an indication of what patients can expect in terms of cost?
Yeah, so I mean, it's,
Can you repeat that question?
yeah, so as far as cost, so, you know, and I'm not going to sugarcoat here. I mean, when a program first starts up and there's not a lot of supply, costs can sometimes be a little bit elevated. But what we've seen as the market matures and as new, you know, registered organizations come online and we start producing products, that's definitely something that we strive for, is to make sure that we're bringing not only quality and safe products, but cost efficient. You know, like I said a little bit earlier, that's one of the questions that we ask when somebody first comes to us is, what's your budget? Not because, you know, we're trying to figure out, okay, how much can we sell you? We're trying to figure out, okay, what are we working with here? Because if we only have a small budget to play with, then we're going to make sure that we go through some of these microdosing techniques. We're going to make sure that we get you on the appropriate ratios and use it sparingly to find that therapeutic threshold so that we could minimize the cost and you could still get the therapeutic benefit. Now, like for example, you know, with the tinctures, you know, in New York, when those first came out, you know, they were anywhere from $80 to $90 for 30 milliliters, or, you know, 200 milligrams of medication. But, you know, today, you know, we sell that same product for $50, $60. So I think, you know, in the ballpark, you know, from my experience, somebody new to cannabis, an initial starting regimen is going to be between $100 to $150, and that regimen might last 30 days.
Are the insurance companies on board with all this?
No. Yeah, unfortunately, it's not covered by insurance. Yeah, so it is out of pocket.
So I have a question about you said you have Crohn's. So I have a nephew who has Crohn's, and same thing, he had to immediately be put on infusion. So I'm kind of curious about that, but I have two questions in regard to that. The first one is, you said, so patients like you who have Crohn's are making fewer cannabinoids, wouldn't we want to, you know, supplement them?
Mm-hmm.
So do you make less cannabinoids?
I'm not sure of that, because there's no actually concrete like blood test or any test to say, okay, this is my...
So you saying that is really, I mean, there's no evidence to say that you're making less, and so you need to supplant or supplement, because there's no evidence of the body not making cannabinoids.
Yeah.
There's no evidence that they don't as well, I agree. Another question is, so my nephew is a child, and we do know that THC does have an impact on the developing brain. So what would, you know, how do you, and the coalition, you know, we're about not getting young people to use drugs and abuse them, and you guys don't want abuse either. So how would you handle a patient like him who, you know, is younger, his brain's still developing, side effects could be severe, more severe, or long-term? So
Yeah.
how do you would handle that?
Absolutely. With any adolescent patients, because you are right, I mean, it is a developing brain, and there are things that, you know, THC affects with that. In a situation like that, I would think that it would be imperative for our pharmacist and our patient care rep to be in touch with that patient's doctor, or whoever their medical team is. Because at the end of the day, they're going to help us make the determination for this patient, because it's going to be the physician or the physician assistant or nurse practitioner that is initially going to make that decision. Okay, this adolescent patient, looking at it from a harm reduction standpoint, because of some of the other treatments that I might be giving them that might create more harm, even though there are some potential red flags with adolescent use of THC, it might be a harm reduction method to be utilizing the THC, but I would want my pharmacist and our patient care rep to be talking in very close communication with that provider throughout that process.
Who's the one doctor who does that?
I don't know, I think
I
we're
would just ask your doctor if there is.
He won't prescribe, he won't recommend. I've reached out for other patients before, and I've driven to Front Royal and other places, and it's been turned down, and basically told I wasted their time, they wasted my time, and gave me my feedback and let me go. I've gone to places where my grandfather has Parkinson's, and And sometimes they want me to come in. I'm like, well, I need to know this is the thing that we're dealing with. Am I gonna waste your time by coming? And the doctor in Staunton couldn't tell me that. So I took my grandfather to Fredericksburg.
Dr. Simon Stan is in part of the program.
There's a website by a really educated herbalist who's considered to be really knowledgeable with cannabis. And it's called buzznutrition.com. And on her website, she has a link that will take you through a list of all the doctors in the state of Virginia who are licensed to prescribe a certificate if you meet the criteria. And that's a really incredible resource. So I can promise you there's more than one doctor in this area. There's a ton of pediatricians who, out of UVA, who are working with the neurology. So of children who have epilepsy and things like that who are licensed. And it's very empowering and very hopeful to see this list because you're recognizing that the allopathic modern medicine is really starting to understand the efficacy of this product.
I compiled the list that has, in Virginia, we just had the list of doctors. I compiled them and I compiled them by specialty. So I put that all together, then I started reaching out to them to find out what they would work with, what patients they would see. And so the trouble I had was with some who work for UVA or other, they only deal with end of life, very, very, very serious conditions. So somebody who may have back pain, or someone who has a mental health disorder through anxiety. Those are people that are having trouble finding doctors.
There are doctors that are on this list, on this website, who would accommodate those patients.
Okay.
What's the name of this website?
Buzznutrition.com.
Buzz Nutrition?
B-U-Z-Z
Normal.
nutrition.com.
I was gonna say, yeah.
That's the list. Yeah, that's the list.
And that number goes up every day. So as of yesterday, I think there were 330 registered physicians that are participating.
And there are some that are not that rigid that would work with people such as myself who's been in chronic pain for 45 years. That's how I got my certificate. I met the criteria. And there is still a lot of confusion because even within the doctors, they're not getting the information that helps them understand how they can continue to extend their licensing status. So they were told when they got their license, when it was given to them, that it expires in a year. So the doctor that prescribed my certificate or gave me my certificate, her license is supposed to expire at the end of the year, but she's not getting any information to help her understand how to reapply for it. So we're still, like you said, in the very early stages of this. But I can promise you there are doctors out there that will work with people.
As a patient, are you getting emails or from the Board of Health?
I've got a certificate from the
But
doctor.
are you getting updates from them?
No,
You
because
should be
the process had nothing to do with the Board of Health.
But
Once you
I mean,
start-
but when you registered, they have been putting out emails to some of the patients.
Okay, I'll look into that.
Yeah,
Appreciate
so
that.
they've been updating people about the disposition of the dispensaries.
So a question from over here, as the young lady asked, is it $50 a certificate, is that correct?
Yes,
Yes,
it is $50.
And the doctor that's here give you the certificate has to be certified also.
Licensed.
So I hate to cut it short. If you have a question that hasn't been answered, you can look at the brochure you have, the Gap Coalition brochure, and there's a phone number and name on it. And if you want to send me your questions, I'd be happy to send them to Mike, or I don't know how I feel about staying around a little bit to answer one-on-one questions. But I know everyone's got a ton of questions, but we'll wrap it up for the afternoon. Thank you all for coming,
And a big thank you to Carrie for everything that she did to put this together today. Thank you, Carrie.